want to introduce myself as well. I'm Jennifer Dell. I am the undergraduate coordinator. I work on the Norman campus, and I'm going to be the host and facilitator of this great panel that we have planned to kick us off on day 2. I want to first give a few announcements, though. So if you plan to attend all day, then we need your name in the chat at least one time. Just one time is all. If you want to get CEUs, and towards the end of this presentation, we will drop a link into the chat.
Sorry, this is my.
That will mute people as they join. Make sure that you're muted so that the background noise does not interfere with our speakers today. So if you plan to attend multiple sessions today, you only have to fill out the CEU evaluation link one time, but please do fill that out. And if you want CEUs, it's required. Diane will be checking to make sure that gets filled out before the CEU certificate gets sent. And we were just talking about Diane Freeman's retirement, which is upcoming. So please submit those evaluations soon so that all of your CEUs can get processed. I want to just call your attention to today's events, since this is the first session. So we have this great session on social workers at the front line and the impact of COVID-19 that will be until 11:45. Then we have a session at noon on hope-centered framework. Then myself and Dustin Huckabee, who's a graduate student, will be talking about Together We Recover and collegiate recovery and recovery efforts on campus. And then there will be panels that are open to students only on practicum readiness. And then our final presentation of the day is on tribal services that Dallas Pettigrew and Dr. Byers will present. So lots of great information today. If you're a Norman student and plan to attend the practicum at 2, there is a different link for that. So please be aware of that. But otherwise, we're all on the same link. This is my first panel to moderate on Zoom. So this is so exciting. Typically when you're in a panel, you can kind of just point and go down the line. But panelists, I'll have to actually call on you so that we don't talk over each other. And there are a few questions that were prepared, and we don't have a ton of time. So this will probably get us to our 11:45. But students and social workers, if you have other things that are of interest to you or other questions, you can drop them in the chat. And if there is time, then I will let the panelists take those questions at the end. So just know that that's an option too. All right, well, let's officially begin. And I want to start by, I'm just going to call on each of our 4 wonderful panelists, and if they can just introduce themselves and then just give a brief description of where you work and what your role is. And I'm going to start with you, Joy.
Okay. Hi, guys. Thanks for the invite. This is awesome. I am Joy Sloan. I'm a licensed clinical social worker. I graduated with my master's program from the University of Oklahoma in 1995. I work at Green Country Behavioral Health, and I have been here for 31 years. I've been here full-time for 29 years, and then I did that whole free 2-year thing with us. Right now, I'm the CEO. I've been the CEO this is my 11th year as being CEO, but I started as a case manager, and I was an intensive case manager. I've done crisis work, and I'd say that's definitely my area of competence, really is crisis work. I still pull call. I'm on call once a month. And I've done a little bit of everything here. I've picked up trash and I've answered the phone. And so this, nothing is below what we do. And we're a certified community behavioral health center. And we serve Muskogee and McIntosh County, and we serve about 7,000 people a year in our counties.
Great, thank you, Joy. Thanks so much. Tom, will you go next?
Sure. My name is Tom Knudsen, also LCSW. Came out of the School of Social Work with my MSW in 2015, and so hasn't been too long. I have done everything from geriatric social work to mental health to homeless services, and really most of my experience is in the homeless services arena. From 2017 to last year, I managed the Oklahoma City Day Shelter, which is primarily what I'm going to be talking about in this call, just because that was the most severely impacted when it comes to COVID policies and how we had to adapt. I am currently at the new Diversion Hub. It's a nonprofit in Oklahoma City, and we work with the justice involved population, those who have come out of the county jail, and help them get connected to resources to help them stay out of the jail and away from further interactions with the justice system. My current position is called Housing Navigator. So we are working with landlords all over the city who will rent to people with felonies. And we work hand in hand with the day shelter as well, just in a different capacity. So yeah, that's kind of the roundabout journey of where I've been.
Great, thank you. Elizabeth, will you go next?
Sure. Good morning. I guess late morning, everyone. I'm Liz Shoemate. I work for Norman Regional Health System, and I'm the manager of outpatient behavioral health here. So at this time, we have two primary programs. We have our intensive outpatient program called the Senior Counseling Center that is geared specifically towards Medicare eligible adults. And then we also have our outpatient counseling center, which is just a traditional outpatient setting for adults 18 and over, providing individual couples counseling and also family therapy when needed. So I'm also a licensed clinical social worker and a graduate of the OU School of Social Work, completed my MSW in 2007, and also a community instructor with the school.
Great, thank you, Liz. And Michelle.
Hi, I'm Michelle Price. I'm the Executive Director for the Chickasaw Nation Child Welfare Services Program. So we provide prevention as well as intervention services to our Chickasaw families as well as other Native families. I received my BSW from East Central University way back when, 1993, and graduated from the OU Master's Program in 97. Since that time, I've worked as a state child welfare worker, as a trainer for DHS, a contract trainer. Also had the liberty and opportunity to teach in the social work program at East Central University for approximately 12 years. And I've worked in our Chickasaw Nation Rehab Center. I am too a licensed clinical social worker, and again, currently serve as the executive director for our Chickasaw families, our child welfare program serving Chickasaw families. So I'm glad to be here, and thank you for this opportunity.
Yes, thank you all for being here. And I love just the diversity in different settings and experiences. So really, really excited about this conversation. In all fairness, let's work backwards now. So this is going to be to you again first, Michelle. And I want to talk about each of you and the ways that the global pandemic, that COVID-19 has had an impact on your role as a social worker, or potentially the role of your setting too, that the answer could be more diverse than just what you've done individually.
Well, serving, as a director, obviously there's a lot of administrative duties. However, during this pandemic, that was heightened more so because it wasn't just thinking about our child welfare program, but our families, but also other programs within our department, as far as creating those mitigation strategies and how we would handle providing our services to our families, and being more even a cheerleader, if you will, a support system, an encourager to all of our team members. I mean, that role too was also more heightened, I think, during this time. You learn a lot about people when you're dealing with change, and particularly this kind of change when there were so many unknowns in this experience. And so I'm very appreciative of my education and my background being a social worker, because I do think it did prepare me for a situation like this. I relied a lot on just, that generalist practice approach, systems theories approach, just looking at the bigger picture of how this pandemic is going to impact so many different systems at so many different levels. So.
Yeah, thank you. Liz, will you take the same question?
Sure. I have to agree with Michelle. I think she stated it very well, just in terms of having that social work education and training and being able to kind of maybe fill in the gaps where some of our colleagues maybe don't have this specific training, and trying to offer our skills to others. I think at the beginning of the pandemic, working specifically with older adults, we did experience a shutdown completely in our department for several weeks. Working with people who are medically fragile, who have comorbidities, it was just very unsafe for them to leave their homes. So we were offering just follow up and support by phone. And as soon as we were able to open our doors, we did just that. And it's been a pretty slow process for us gaining momentum in our intensive outpatient program, because we provide primarily group therapy. So you can imagine trying to maneuver social distancing and ensuring that our facility is safe and sanitized. We've done a great job at that, but that's been intensified for sure. I think during the closure of our program, just my role as a social worker, just being able to reach out to other departments, the co-coordinator of our peer support team internally for hospital staff. So I did lots of times of just setting up shop in a break room, various departments throughout the hospital. So specifically the ICU nurses, they experienced a real change during COVID, and really had some pretty traumatic experiences as healthcare providers. So just trying to provide support to those staff directly, also providing some training and support to other managers and directors in the system, providing just about education about self-care, well-being, and adjusting to all the different changes that we have all encountered during the pandemic. So just finding ways to be resourceful to others. And then also during our shutdown of our program temporarily, we reopened as a childcare facility for our employees. So trying to provide some extra support to those essential workers.
Yeah, it just hearing Michelle and Liz talk, it's just hit me like, wow, it's been just a little bit over a year. But what both of you just explained seems like it could have been a life career of different changes and everything. So, Tom, to you, what are ways that the global pandemic has impacted your role as a social worker working with your communities?
Yeah, so at the day shelter, this is a context where you have about 425 individuals in one congregating space, all of whom are experiencing homelessness, living out in the elements, many with untreated substance abuse and mental illness. And so we found ourselves in this predicament where we had to create conditions that were cognizant of safety and mostly really run against the whole premise of what the day shelter is, right? You have all these people who are in the same space, sitting at tables, touching surfaces, eating and showering and doing, basic hygiene essentials that are not safe when you're talking about being in a pandemic and trying to isolate people and contain the spread of COVID. And so we had to completely shut down the inside part of the day shelter. But it wasn't until we kind of figured some things out along the way. We had first decided to bring in people and create an express line where we would let 6 people in at a time, and they would shower in our bathrooms. And then after they had their shower and dropped off their towel, they'd get a meal and go out the door. And then we realized that no matter how many people you're sending in at a time, at the end of the day, you've still had 400 people in the same building, just at different times, who are still breathing the same air, touching the same surfaces. And so at that point, we had, after leadership team meetings and just trying to figure this out as we go, we had decided to shift all the services to outside and we makeshifted the day shelter into a donation space, because we were putting out donation requests to the community for masks and clothing. And we really doubled down on our outreach efforts. So instead of the folks coming to the day shelter, we would go out to different transient campsites all over the city and take food and hygiene supplies. And so I would say probably the biggest lessons that we learned was just how to change your priorities, because what it looked like to care for our clients before the pandemic was obviously making contact with them and transporting them to the case management appointments, doing home visits, taking them to where they needed to go. And then after COVID, we had to freeze home visits, and we had to freeze transportation requests, and we had to limit our contact with clients, and what it looked like to love and care for them where they were at shifted to prioritizing their safety. And that was very, very hard. And we had to sort of wear a different lens in how to prioritize what care for our clients looks like.
Thank you, Tom. And Joy, I know that working at Community Mental Health Center, there's probably some similarities to what Tom just shared. Will you share your experience and the experience of
Absolutely. I was just listening to Michelle and Liz and Tom, and yes, and yes, and yes, and yes. Systems theory and confidentiality. Whenever you think, oh my gosh, they cannot tell me anything more about this, listen, because there's more to know about this. March the 16th of last year, we closed our front door to all of our sites, and we started doing everything either in our parking lot or somewhere else in the community. And I mean, it totally changed the way we do business. Last week, so it was 57 weeks, I guess, last week we cracked our door a little bit, but we're still doing a hybrid of everything. But we totally changed everything that we did. And I just, from an agency level, we're pretty used to change as community mental health centers. Change is just inevitable. So I would say that my staff was pretty adaptable to that, but this was a change like no other, obviously. So certainly finding those times and ways to take care of staff was so important. We had staff picnics about once every other month. We did all kinds of things that we could think of to keep staff in our same routine. Our annual meeting, we did all virtually, and we surprised people at their houses, and just trying to keep staff engaged to know that we still appreciated them and understand what they're doing was so different and so difficult. Our crisis unit, we have a 16-bed crisis unit. Obviously, we changed. We never closed. There are some of us, I never missed a day's work because of COVID until a short time that I actually got COVID, but we never closed. So our staff did not work. As a matter of fact, we've hired 57 staff from last year to right now. And two groups of that, not all of them, but two groups was we created 2 additional outreach teams, much like what Tom was talking about, that we really increase what our community collaborations look like. We have a team now that is at our homeless shelter every day. We have a team that still goes grocery shopping for people that are not even our clients. We just had a public phone number, and we told the community, look, if you're elderly and you can't get out, we will go grocery shop for you. So we did a lot of things that were outside our typical scope of practice, if you will, but it was things that our community needed. So we had our agency and the clients to care for still, and we had our community to care for in a different way. We created collaborations with the housing that we never did before, law enforcement, and IMSA. And what I'm talking about too is really providing that support for law enforcement and IMSA and our neighbors building neighborhoods, just helping some of those folks cope with just the change of what they're doing. We still have staff that are not back. We have pushed out about, last count, 500 iPads. So a lot of our families have iPads, students have iPads, Our clients have iPads. Every school and every law enforcement officer that serves our 2 counties has an iPad. And so they can call that iPad and get a therapist or a clinician 24/7. And we really did that for law enforcement as a means, not only if they have someone that they want us to see professionally, but also for them and their families if they need some care. And really just working on policy. Policy was a big deal, changing our policy for our agency. I was on a committee that changed policy for our community. And then we also worked on changing policy at the state level for the Oklahoma Department of Mental Health and Substance Abuse. And they really led a charge for us and really helped. And if you haven't gotten on their website, they have lots of information on there to help, for self-care and things like that. So we literally changed everything about our business, and we're still there.
So as Joy's talking, I'm thinking as social workers, we look at the person and environment. And so how do we adjust when the whole environment really shifts overnight? And what each of you have shared really, really speaks wonders to just the resilience of our profession and the continued need for social workers to show up in the community. So all of you already kind of touched on this next question. So feel free if there's additional examples you want to add, but let's talk about ways that your job has shifted and then take that to the next step. What are ways that is going to have a lasting impact either on the field or on the agency or maybe on individuals you serve? So if there's other examples of ways your job has shifted, share that. And then kind of the second part 2, is how is that going to have a lasting impact? Liz, do you mind going first for this one?
Sure. I think in terms of what's changed and what's shifted has just been doing whatever needs to be done. I think previously I did this all the time in my areas of responsibility, but now kind of working more intricately within the whole system and just trying to find out, where can, not just myself, but my team, my employees, how can we best serve the system as a whole? We know how to provide behavioral health services. We know how to work with our patients and their support systems and collaborate within our own system, but we've tried to kind of get outside of what we've normally been doing and offer these skills and ideas and just being innovative. So I think during the last year, we have, because we were closed and our numbers were down in terms of patients in a hospital setting that are outpatient, we started 3 separate pilot programs, and one of which was transportation. Another was working with primary care and really responding to the needs of primary care patients when it comes to depression, anxiety, and just response to the pandemic. And then another one was collaborating with the city of Norman and their after school program and providing on-site behavioral health services. So really kind of just looking outside the scope of the hospital walls, how to better engage the community, and then also help other areas in the system kind of be more cognizant of people and how we're helping people, and kind of, I think, creating some realistic expectations of how we're all responding to the pandemic. Not one of us can say that we haven't been impacted, even if we haven't had COVID directly, just the social changes that we've all experienced. So I kind of think just moving forward, being more open to getting involved at a more system level and trying to strategize and find ways that we can help everyone do better, whether it be our staff, our patients, the community as a whole. And also, I think that sometimes social workers aren't always at the table for decision making, and seeing the value that we have to offer, and our perspective and our training. Really, we see things so differently sometimes that people are missing what we see, and so we have value, and we should be at the table for every conversation.
Great, thank you. Tom, will you go next? The
Sure.
Continued ways things have shifted, and then lasting impact.
So I think as far as ways that our professional role has shifted, COVID has really identified new needs and gaps in the community that, you know, it almost kind of felt like the target moved. So, for example, the night shelters every year in Oklahoma City during the winter on the nights that are below freezing, they will lift policies and let anybody come in to sleep on a mat just to get out of the cold. So it's overflow shelter. But because of COVID, they could not take in as many people, so that they could space people out and adhere to social distancing. And so there was not enough beds in our city for people who were experiencing homelessness to go to get out of the cold weather. And so off the cuff, the Homeless Alliance and the Mental Health Association and the city of Oklahoma City leased out an elementary school building, an abandoned elementary school building at Willard Shelter is what they called it, because it was Willard Elementary. And so they used this space for overflow shelter in the city quite innovatively. And on nights that were at capacity, there were around 250 to 270 people there. And so this was just an example of like a new intervention that our city was able to come up with in collaboration with the homeless services to meet this need. And I think in terms of lasting impact, it's really created, we've kind of helped create policies for our new low barrier night shelter. So City Care, the organization that I currently work for, has opened up a new low barrier night shelter, 128 beds. And this was in the works long before COVID. But we were able to use some of the policies and some of the things that we learned operating the temporary overflow shelter at Willard Elementary to then carry over to our long-term low barrier shelter that opened this week. And so I think it really speaks to some of where the need changes as this thing morphs. And it feels like any progress we had made in the area of homelessness as a city, COVID just wiped out. So, for example, the statistics on our point in time count in 2019, the number of unsheltered individuals was 1,300, and that includes people staying in transitional beds and then uninhabitable spaces. But that number in 2020 was 1,500, and so. When you take into effect evictions and more evictions that have happened from people living on minimum wage jobs and trying to make ends meet, it's just created more attention in the area of homelessness. And I think it's led to some really good starts in terms of the new low barrier night shelter. But I think as a whole, it's shifted our priorities. And as we were trying to figure out how are we going to do overflow shelter this winter in 2020 with a limited number of bed spaces, we were then able to take what we learned and take what we implemented from that. And as we opened the new night shelter on Villa that is permanent, we were already kind of at a head start in that. And so I think it's really that's just one example that I could point to on how it's impacted the field long term.
Yeah, great examples, both what you and Liz shared. You know, we're just expanding all the time what we think that we're able to do. Joy, can I go to you next?
Absolutely. I think, you know, I was sitting and listening to what they were saying, and certainly about social workers being at the table. And what I think a positive, if you will, out of all of this pandemic is that almost every day, even this long later, someone or me at our agency gets a call to say, hey, we're going to have this meeting and we want to make sure you guys are at the table. I think sometimes the people that we serve from a communal health standpoint are those people. And suddenly those people were us. They were our family members and our chief of police and our bank president. And so I think there was just a tiny little step of some destigmatization about what we do and what we provide, not only as mental health providers, but as social workers as a whole. I cannot tell you how many community boards and meetings and commissions and that have been formed, and there is someone from our agency at every table, and I think that that's a good thing. You know, another good thing that I think came out of this, if you will, is that our community mental health system from a statewide perspective, I mean, from the first day, we were all kind of working like, what do we need for ourselves and what do we need for our communities? But instantly, I mean, I had phone calls almost that very first week of COVID with Verna Faust from Red Rock in Oklahoma City and Gail Lapidus from Tulsa at Family and Children's. And we all helped each other. We all helped each other develop some policies. Those policy classes that you guys take in undergrad work, you know, 30 years later, I still remember things. I mean, it's such a valuable tool that I have in my toolbox, and just the collaboration and the collegial relationships that have been formed out of this terrible pandemic, or been enhanced. I mean, that has been such a positive. And I can't think, I mean, I literally cannot think of one community type thing in our community that really has not changed. And just the ability of people to say, you know, I didn't think about doing this before, but here's how I think we can do it. So we're going to go ahead and try it. And if we mess up, okay, we'll do something different, but let's put it out there and let's get moving to help some folks that are just truly in need. And of all the bad things that it's caused, there have been some very long, good, lasting things that will come of this for years to come, for sure.
Excellent. And hold that thought, because that's the last question too. So we'll want to share more about just kind of lessons learned and that. Gosh, just thinking about the collaboration, the importance of representation of social workers at the table, and all these enhancements, they are really, really important. I want to go to Michelle now, and the same question, Michelle, just ways that the role is shifted, and then the impact that will have.
Well, some of the, you know, roles that have shifted, I think it has added a lot more responsibilities, I would say, to every, you know, person that's working in the child welfare system for us right now. We do daily screeners. So we start our morning by participating and answering questions on a daily screener. And that helps to determine whether or not that person reports to work. And we all work from home right now. We do rotate into our offices, and that's how it's been. For a short time, we were all at home. All the workers were at home, but our doors continued to stay open, though. There was someone in our building there to assess our clients and whatnot. But also then in the field, when our workers go to the field, they're obligated to screen our families too. So it may be a planned home visit, and if so, that conversation can take place first over the phone, but just to assess and make sure that our families aren't running a fever or something of that nature, you know, which would cause a potential, you know, worker to get COVID themselves. With our investigations, though, it really didn't change anything, because regardless if a family had symptoms, those investigations still had to work. But then we had to think of ways of, well, how will we conduct those interviews? You know, so maintaining some type of social distance, which, you know, creates its own complex problems with trying to interview children or interview parents or whatnot. But even as we are starting to look at reopening, if you will, everyone returning and that kind of thing, that still continues to add additional responsibilities and thinking as far as how are we going to handle that in person. You know, if a family has been vaccinated, if they haven't, if workers have been vaccinated, if they haven't. And so we're thinking about all of that too. And that's going to also guide our work then in the future, depending on those things. So our, what I continue to see our work shifting will be with our court testimony. At this point in time, we've been able to provide testimony over the phone or through Zoom, but it really depended on the courts and how they were set up too. So again, it just impacted all those macro systems at very different levels and how we were to communicate with one another. But we also provide testimony to out of state on our out of state cases as well. And so again, just connecting with those court systems, trying to figure out, what's the best way to do that. But I still see some of those things continuing, even though a lot of agencies are opening back up. The lasting impact, I would say that the use of Zoom and Microsoft Teams has had a lasting impact, and it's probably something we will continue to use simply because it does cut down on travel time and things of that nature. However, another issue with that is it tends to, if you're not careful, it takes up the whole entire day pretty easily. Before, if we're driving to meetings, you had a little break there to kind of rethink some things or collect your thoughts or whatnot, but it comes with its own complexities too, depending on how your schedule is set up. So there are so many different things. I know for me, I've always been concerned about people and their well-being, but this pandemic will forever change the way I look and think and have concern for people, particularly our staff, checking in with them on a regular basis and making sure they are okay. And like Joy was saying earlier, providing opportunities to share another way that they might better care for themselves. But also though, just relating to them, me being vulnerable and sharing some of those things with them too. Yes, I have the same concerns. Yes, that's a worry that I have too, but together we can do this. And I think the most important message that our team was able to work from is no one's been here before. We're all on the same page, so no one has all the answers. We'll work it out as we go. And so that too is going to have that lasting impact. And I hate to bring up something different, but this works as well. Those words work as well as we are dealing with McGirt rulings for the state of Oklahoma. So, no one's been here. We're all going to figure it out, and we're all in it together. And I think that was what was positive as well, is to know that we're not alone. None of us are in this alone trying to deal with it. We don't have to carry the burden ourselves because we have each other to lean on.
Yeah, thank you for sharing all that, Michelle. So powerful. So this time's going so fast because there's so many good things to say. But the last question that I had was just, and we've already touched on this, but let's kind of punctuate it with talking about what are the lessons learned from the last, Joy said it was at 57 weeks or, from the last 12 months. So you've each already shared a few of those, but if you can just highlight, one or two of the major really lessons learned to really end our time today. And Joy, will you start for us?
Sure. I think lessons learned is, and we send out an email every day to say, look what we've been doing, you guys. You guys are awesome. Look what we've done. And just to get staff to be creative. It's okay to think. I mean, I tell people all the time, we hire you to think, not to follow every little thing that we're doing. So think outside the box. And like I said before, we've done things that we said 2 days later, geez, that was a dumb thing to do. Let's do something else. But lessons learned is that people are pretty darn resilient. We know that, but when you see it in action, certainly with our staff and across the state, I've seen it that people are resilient, and that if you're just open and willing to make a little change or just be vulnerable, like what Michelle said, that holding each other up is a really important piece of this whole pandemic. And I think from an agency standpoint, I can't see us ever going back to the way we did services before. I think we'll always have some type of hybrid model. That's a good thing. It's okay. We've got, policies. We're forever working on policies now and trying to get something that's not going to change for a while. And so just some of those things we'll keep working on. But lessons learned is that we can do this. We can get through this. So
I like that. Michelle, will you share next?
Sure. I think I would just have to echo with what Joy shared is we can do this. And I feel that our team definitely would be better prepared for another pandemic. Hopefully we don't have to deal with that. But policies, procedures, and, doing all of this, it was, I think, hard to create sometimes because there wasn't a system we could necessarily follow or method already. But now we kind of have that down. So that's promising too, being able to have that ready and available to us to look at. One of the other things too I wanted to mention is that for me, teamwork carries a much deeper meaning than what it ever did before. So I think that's something I've learned through this process. Just again, being willing to help one another, being able to rely. The other thing I've learned is, and we hear it all the time in social work, change is inevitable, but oh, is it inevitable? And so just keeping that in mind, but also I think dealing with it in the right frame of mind. So for me, emotional intelligence and maturity was a factor in just, really taking that in from our other team members just to see how well they were able to handle things. And again, like I think Joyce shared earlier, the resilience, we are resilient people. And so it's very uplifting to know that we can move forward successfully. So thank you.
Thank you, Michelle. Liz, will you share your thoughts next?
Sure. I think just to reiterate what's already been said, but just embracing change and not only for us in the field, but also for those we serve. Everybody has had this commonality of having to make changes and responding to that. And there has clearly been lots of ups and downs and challenges, but I think that this is a good reference point for everyone that, when this pandemic started, we all made sacrifices, we all made changes, and we're able and capable of doing it, even though maybe the road to doing so was difficult. But, depending upon where you're at professionally, how large your organization is, change can be very, very difficult. And we've all made changes and we're still standing, right? So I think that this is just a good learning opportunity that change, even in difficult situations, can be good. And when we're doing it, frequently and rapidly, that we can take a step back and say, oh, this didn't work. How can we make it better next time? How can we firm up the process and the policies and move forward? So it's been challenging, but I think everyone's learned a new skill.
Great, thank you. Yeah, all of you talking about policies and the procedures, how none of these decisions are made in isolation, just like we don't function in isolation. We need the community. Tom, I'll turn it over to you to kind of your lessons learned as well.
Yeah, so really just in line with what everybody else was saying, the adaptation, the flexibility, the changing of priorities, I think spoke volumes on our team. Some of the most life-giving and rejuvenating times that we had were just as a team taking the first 30 minutes of the morning and just being together and allowing people space to process the uncertainties of what we were living in and what we were going through, and leaning on each other in that process. The team building process was challenging and difficult, but in the end was just very life-giving and refreshing. And I think I just learned in a general way that people still really care. I know that can sound cheesy and kind of overused, but working in this for a while, you don't see a whole lot of Hollywood happy endings. You don't see, a lot of times you see people get worse and lives continue to tank, and you can kind of get a jaded view on humanity. And that's easy for any of us, but I was just floored by the amount of generosity that I saw from our community. When our showers were very limited because we were only letting 6 people in at a time, there was quite a significant number of clients that weren't able to just get a shower. And we had a lady show up with a trailer that she had makeshift a shower unit out of a trailer and showed up in the parking lot. And then on the days that she couldn't come, she rented out a Motel 6 and had arranged transportation for everybody to literally fill up this Motel 6 so that they could use it for showers. So just people coming out of the woodwork left and right, showing up to help unload donation trucks from regional food bank and other donors, and just people that would just showed up, like just to show up and put on a mask and a pair of gloves and say, like, how can I help? That's something that we take for granted often, but these are people that just want to give their time, talent, and energy to make life better for others. And you really saw that during this pandemic, and specifically in our context. And I think, to me, that was the biggest, most miraculous element in all of this, is just seeing the way that people do still really care at the end of the day.
What a great way to go out, because that is so important, and is so vital to just continuing this important work. It has been such a pleasure to spend the last 45 minutes with the 4 of you. Each of you shared such great information. This is the downside of the Zoom, because I feel like we all need to give you a big standing ovation and a huge round of applause. So maybe if you have the reaction button, like, let's give our speakers the round of applause or the thumbs up, because just what a great information to share. And I know many of you on this call have had similar experiences, and so also give yourselves a pat on the back, because you're out there working hard, or for our students, you're learning all this so that you can go out and also be the game changers. So again, to Joy and Tom and Liz and Michelle, thank you. I can clap because I'm unmuted. Thanks for the work that you're doing on the front lines, and really, really appreciate it. If you're attending for CEUs, hopefully you saw Christy's message. And if this is your only session today, fill out the CEUs. If you're hanging around, then take a short personal break and come back in 10 minutes and learn about hope. And again, thank you all. Much appreciated.